My colleague, Dr. Henk Vees and I, founded Diabetes as a clinic 100% dedicated to type 1 diabetes care. Despite improvements in therapy, people with type 1 diabetes are at a significant risk to develop complications that compromise their health. We contribute to good health and well-being by following and implementing our mission towards a complication-free future. And we do so with a value-based approach. Soon after our start, we realized that our convictions and way of organizing the healthcare we offered was exactly what value-based healthcare entails. Our fundamental task is not to just deliver healthcare and get reimbursed by it. No, our fundamental task is to deliver value to the patient. To accomplish this, we work with all the 6 elements of the Porter's value-based healthcare agenda. The first and most important step is to create an integrated practice unit, or IPU. All our healthcare providers are organized around the patient's medical condition. In hospitals, every healthcare provider has its own department and leadership, while at Diabetes, the IPU ensures collaboration that contributes to best outcomes. Secondly, we measure the outcomes of every individual patient and also of groups of patients with similar characteristics or treatment. Measuring outcomes allows to develop dashboards that help our managers and doctors to make decisions and improve and innovate constantly. A constant flow of medical data from the devices our patients use allow us to constantly monitor our patient's medical condition. The third agenda item of value-based healthcare is to use bundled payments containing all the costs of the patient. This allows for a proper way of measuring the cost and validate the equation of value-based healthcare. Quality equals value divided by costs. In many hospitals, the true costs of treatments are not known. In our new contracts with insurance companies, we include all the costs that are attributable to diabetes, its treatment and its complications. Our integrated practice unit is responsible for this, even for the costs that are made by partners outside. This brings us at the fourth value-based healthcare agenda point, to integrate care delivery among separate facilities. We connect to other healthcare organizations when we need a specific care for problems and conditions that the IPU cannot solve or treat. However, the quality and payment remain the responsibility of us. Furthermore, adding value that matters to patients and improve their lives requires to allow more patients to reach this care. This is why we expanded geographically to 5 locations in the Netherlands and are now preparing for international expansion. And lastly, it is important to develop optimal IT for the input and output of data and parameters. IT integration at a very high level, from employees' data sets to historic and current patient data to daily reporting of more than 200 outcome parameters, was possible through the development of a dedicated disease management system. However, there are some challenges in working with this value-based approach, such as explaining to stakeholders what value that matters to patients actually is. Let's zoom in on healthcare insurance companies and government. They are interested in value-based care, but similar to hospitals, only pick aspects of the value-based healthcare agenda, which is only marginally improving care. Moreover, chronic disease improvement requires a long-term agenda and all 6 items. Secondly, patients need data from different care providers to identify the differences in care, and those data are not available from other competitors. Thus, we want to explain to patients what we offer and why it adds value. In this way, they can make autonomous decisions based on proper available information. Another challenge is that developing the IPU further requires not only dedicated staff and technology, but also constantly changing treatment and technology. It is challenging to find good employees and to keep them in a mode that allows them to develop in the rapidly changing environment of healthcare. Good health and well-being are among the most valued aspects of life. When chronic diseases like type 1 diabetes strike in a person and a family, one starts to realize the importance of it. Good healthcare systems are necessary, but are challenged by increasing complexity and staggering costs. Moreover, the system is often paid for volume and not for value and outcome. That is why we choose for a focused approach, just like Olympic sporters do. become the best in one specialty, and develop and sustain the best possible care by adding value that matters to patients.